Hello everyone, today we are going to talk about miscarriage. Miscarriage is expulsion or threaten to expel a fetus or embryo before 24 weeks of gestation at a stage of pregnancy when it is incapable of independent survival. Incidence rates are high as 10 to 20% of pregnancies. Etiology factors can be chromosomal abnormalities, maternal factors, abnormalities of uterus, infections such as cytomegalovirus, and thrombotic and coagulation disorders. There are few types. Rather than saying types, we can call those as stages. First stage would be threatened miscarriage, then incomplete miscarriage, complete miscarriage, inevitable miscarriage, miscarriage. And there's a type called septic miscarriage also. In threatened miscarriage, bleeding is most of the time spotting only. There may be pain which is minimal or there not be pain, and pregnancy symptoms are present. On examination, uterine size is compatible with POA, cervical os is closed. An ultrasound scan, intrauterine pregnancy with a viable pregnancy can be seen. Management is mainly reassure and continue the folic acid. And patient should advise to have adequate rest. Then we are discussing about miscarriage. It's early fetal demise and embryonic pregnancy, we call it like that. Bleeding can be minimal or just only the brownish vaginal discharge. There won't be any pain and pregnant symptoms are receding. On examination, uterus is lesser than the period of amenorrhea and cervix os is closed. On ultrasound scan, there's non-viable pregnancy. Management is mainly expectant, medical or surgical. And we are discussing about the inevitable miscarriage. In that, bleeding is present. It's heavy with clots and there's a severe pain. On examination, cervical os is open. On ultrasound scan, viable or non-viable fetus can be seen. This also management either expectant, medical or surgical can be. Complete miscarriage, bleeding is minimal but had a heavy bleeding with clots and passing products. Pain minimal but had severe pain with bleeding. On examination, uterine is lesser than period of amenorrhea, cervical os is closed. On ultrasound scan, empty uterus can be seen with no products. Management is breaking the bad news and counseling, and no intervention is usually necessary. Now we are going to talk about incomplete miscarriage. There, bleeding can be there with clots and products. Pain is present. On examination, cervical os is open. Products present at the os. Ultrasound scan shows the retained products present. Management can be expectant, medical or surgical. Now we are going to talk about how can we do the expectant management. Usually, we allow to nature to resolve the miscarriage. Advantages are no surgical anesthetic risk. Disadvantages are may take time and the psychological impact to the mother. Then we are moving to the medical management. Here we use prostaglandin either orally or vaginally. Type of prostaglandin we use is misoprostol. Advantages are it's cheap and no surgical anesthetic complications. Disadvantages may need to do surgical evacuation if the procedure fails and may take time and pain and bleeding. Then we talk about the surgical management. We do the evacuation of retained products of conception. We call it ERPC. There are several advantages like high success rate, less pain. Disadvantage, cervical damage, which will eventually predispose to cervical incompetence, and uterine perforation, infection, intrauterine adhesions. Then we talk about the miscarriages. Now we are moving to the recurrent miscarriages. What is recurrent miscarriage? Spontaneous loss of 3 or more consecutive pregnancies. We call it as recurrent miscarriages. Incidence are 1%. Causes can be antiphospholipid syndrome, genetic, fetal chromosomal abnormalities, thrombophilic disorders, protein C and S deficiencies, and cervical incompetence. There you had to do few investigations. You had to do parental blood for karyotyping, cytogenetic analysis of products of conception, pelvic ultrasound scan, thrombophilia screening, lupus anticoagulant and anticardiolipin antibodies, and double-stranded DNA. In there, you have to manage according to depending on the cause, majority due to thrombophilic causes. Low dose of aspirin and heparin has shown to increase the pregnancy rate. And you can do cervical circulage at the second trimester. Genetic referral can be done. So thank you for watching the video and subscribe for more videos.